Hi guys, welcome to the channel. I'm Dr. Sylvia, a general practitioner, and today we are talking about myomectomy, particularly looking at a lady's experience with fibroids and how things went from developing one symptom to the other. Things got really bad and she eventually had a myomectomy and her experience after surgery. So I hope that watching this video will help us to put things in perspective. Myomectomy is not the only treatment option for fibroids. It depends on several other things. I have talked about the different options for treating fibroids on my channel. We've got the Fibroids Knowledge series and we have videos that describe different fibroid treatments going from surgical, medical, alternative therapies, uterine fibroid embolization, some natural methods that people might want to adopt. So myomectomy is by no means the only option, but I think it's reasonable to consider it, and I'm going to leave the link for the video in the description. And I would really encourage you to go and watch Erica's story. It's quite interesting and inspiring. So guys, let's just jump into the video. Let me know what you think in the comments. Give this video a like if you find it useful, and please don't forget to subscribe to the channel. So we're talking about Erica. Meet Erica. She is a Black female entrepreneur. She shared her story on Good Morning America a few weeks or months ago. And Erica's 35, and one of the things that underpins her sharing the story is about helping to raise awareness and encouraging women, particularly Black women with fibroids, to advocate for themselves. So Erica shares her story about the fear of having surgery, but her message is really that the symptoms, the distress that you might be going through with the symptoms is actually worse than what you might experience with surgery and after surgery. So her symptoms with fibroids started when she was about 29. As you know, fibroids are benign growths of the womb, and she tells us how she was having symptoms including problems with pain in her pelvis and her abdomen. She had problems with passing urine. She had problems with bloating. Now, the thing about fibroids is as they grow, there is potential for the fibroids, because the womb is located between the bladder in front and the rectum or anus behind. There is quite a lot of potential for the fibroids as they grow to put pressure and to press against the organs that's around it. And if, for example, the fibroid is pressing on the bladder in front of it, then it can prevent the flow of urine out of the bladder, and that can cause problems like difficulty emptying the bladder. Okay, and it can also result in having frequent urine infections, which is what one of the symptoms Erica had, because since the bladder can't empty properly, that allows germs to remain and multiply in the bladder. Remember that one of the things that we recommend is empty your bladder as often as you can. That prevents urine infections. But in this case, because the fibroid is keeping her bladder closed and she can't empty it often as it should be, bacteria can stay in the bladder, multiply, and lead to frequent infections. So that's one of the problems that she was having. Something else that she also experienced, as she tells us, is that she developed bloating and discomfort in her tummy. And again, this has to do with the fibroid pressing against her rectum or pressing against her anus, and so she's not able to empty her bowels, so she feels constipated. And because you're not able to empty your bowels regularly, you start getting bloated. You eat small amounts of food and you feel so full and bloated. She talks about eventually going off to the doctor because she started to have abnormal bleeding. She was experiencing very heavy periods. In fibroids, you can have heavy periods, you can have painful periods, you can have heavy painful periods, you can also have bleeding in between the periods. All sorts of things that can just mess about the menstrual cycle can happen with fibroids. And it was this in addition to the other business going on with the bloating, the abdomen, the size of a 6-month pregnancy. So with all of these distressing things going on, she took herself off to her doctor to have this discussion about what was going on and what tests to do. Got to that point where it was clear that things were just not right. She got some tests done, including a vaginal or transvaginal ultrasound scan. A transvaginal ultrasound scan is a scan where you have the ultrasound probe that's placed in the vagina, because that allows the doctor or whoever is carrying out the scan to be able to see the womb and the ovaries, the fallopian tube. So it gives a really good view of whether there are any abnormalities that you can tell around the surface of these organs. At that point, the doctor was able to identify that she had fibroids, and not just one fibroid. She had a number of fibroids. I think she says that she had 10 fibroids, and she was really shocked at the number that she had. So it's important to also say that fibroids can happen in so many different ways in women. A woman might have just one single fibroid, or a woman can have several fibroids. What's important is where these fibroids located, how large are they. So one single fibroid that is very large can cause problems. One single fibroid in a particular location can cause more problems than another in a different location. Several fibroids can also cause problems, so it depends. I think it's always important, I always like to emphasize that for every woman it's different, and so we need to be very clear what type of fibroids that each person has, where they are, and so on, and that can help determine the treatment. It can contribute to the symptoms. It will determine the symptoms that the person has, but it also helps to determine what kind of treatment would work best for a woman. So it's important to say that different types of fibroids can happen. So she had about 10 or so, and she tells us that by the time that she discovered or that she was diagnosed with fibroids, her womb was already quite enlarged, because a non-pregnant womb is about the size of a small pear, a non-pregnant womb. But by the time she was diagnosed with her fibroids, and she was 10 weeks, that was about 10 weeks pregnancy size, so that's about the size of a big orange. So already the fibroids have already stretched the womb. This continued to happen because that's generally what fibroids do, that they will most likely continue to grow. They are under the effect of circulating estrogen. So we don't know what other processes she went to before she made her decision or her choice of procedure. Like I said, there is a range of different things that you could use. The medical treatments, non-surgical or alternatives to surgery. For example, she talks about radiofrequency ablation, which is another procedure that you can have for fibroids, and it's a minimally invasive procedure. And what that means is it is not having major surgery where the abdomen or the pelvis is cut. No, there'll be cuts, but very small. So that's why it's minimally invasive. The surgeon isn't going to go into the abdomen and start moving, organs around. No, there'll be two small cuts, usually into the belly button, where you have a small cut, and then the second one just above the womb. The first cut to allow a telescope with light to go pass through the belly button, and the second cut that allows an ultrasound device that the surgeon is going to be able to use to see the fibroids. And so what happens is that they introduce a device like a needle, directly into each fibroid, and once they're in the middle of the fibroid, guided by the ultrasound, they're able to deploy or apply heat to the fibroid, and that heat destroys the fibroid. And they do that until they're able to apply the heat to all the fibroids that they can see. What we know from this procedure is that within 3-4 months of having had the procedure, but the fibroid can shrink to nearly half its size because the heat has destroyed it. Yeah, it's a minimally invasive procedure. It's a day case procedure, so you're not staying in hospital long, reduced likelihood of any infections. So it is something that one could consider as an alternative to surgery, and which she went with in this case. Now, it's also good to look at the possibility of fibroids recurring, and I think we should make sure that women are told about this, because you can have treatment for fibroids, and that might be radiofrequency ablation like she did. It could be uterine artery embolization. It could even be myomectomy. Fibroids can still grow. And don't forget that while we have some ideas about some of the things that increase the risks of fibroid happening, we don't know everything. Okay, so I'm making this point because, as she explains, her fibroids did come back a year after she had the ablation treatment. It did work to an extent. She had good control of the symptoms. The bloating came down, the bleeding reduced, but after a year, things started going bad again. And this is the point that she decided that she wanted to go down the route of surgery. At this point, fibroids had grown from a 10-week size pregnancy to a 6-month size pregnancy over the number of years, sort of 3-4 years as she describes it to me. She had that discussion, went back to her doctor and had a myomectomy. So it's really important to emphasize this business of being aware, getting information, and going back to your doctor and pushing back to say, well, this hasn't worked. I come come across comments from women who say that the doctor just left them on pills. Well, patients also do have agency and an option for a second or third opinions, particularly if you've been placed, for example, if we've been put on the contraceptive pill or put on the injection or had a coil to try and manage or control heavy bleeding and it's not working. Usually by 3 to 4 months of using any of these hormonal methods, that's usually enough time they should have worked. And so if the symptoms that you're using them to treat are still going on, then that suggests that they're not working, they're not doing the job. And women get a lot of distress, and we suffer a lot in silence, and we just tolerate certain symptoms or experience because we don't know more. And that's why I love what Erica's done, and that's why I'm doing this video, to make sure that her message gets shared to a much wider audience. I know lots of she talks about her experience in the United States where she lives. However, fibroids are so much more common in women of African background, whether it's African American or Afro-Caribbean, compared to other ethnicities. The experience of similar symptoms can apply to you in West Africa, can apply to you in Jamaica, wherever, because we tend to experience fibroids more compared to other races, reasons we do not know. So we're still sort of looking at that. So she went ahead to have a myomectomy. Myomectomy is a procedure where fibroids are removed, different from a hysterectomy where the womb is removed. Generally, this particular treatment option that we consider depends on your symptoms, the types of fibroids that you have, as well as your preference and your stage. So for example, have you started your family yet? Have you had all the children that you hope to have, you want to have? If a woman is in her sort of early 40s and she's had all her kids, then it's not unreasonable if she's having very bad symptoms, and for example, heavy bleeding, terrible back pain, fatigue because of anemia. It's not unreasonable to say perhaps a hysterectomy will solve this problem, in which case the womb is removed, and that sort of shuts everything off because you've taken away the womb from where the fibroids arise. However, that's not the case for many of us. Many women will get the diagnosis of fibroids in their 20s, late 20s, for example, like Erica, or in their 30s, and at that point they may not have started their families, they may still be working or whichever, whatever the case may be. So what you don't want to do, of course, is a hysterectomy. That is not the first line or not the first treatment option that we should be provided with. There should be discussions about things like medical options or ablation, for example, that like Erica had, or uterine fibroid embolization or surgery like myomectomy. And myomectomy can be conducted in different ways. So there are different ways that you can have a myomectomy depending again on the type of your fibroid and its location. And all this should be discussed with your gynecologist, your doctor, before you go on to make a decision, so that you're well informed and you can make a choice that is most likely suitable for you. But I want to put it out there that myomectomy shouldn't be something that we're afraid of, because it is one of those treatments, when conducted properly with the right support, without the complications of infection or bleeding and so on, and where women can have really good outcomes, and women have gone on to have children even after having myomectomy. So I know that's one of the fears that we have, but it's good to say that conducted properly in the experienced hands, in the hands of skilled surgeons, that is a very valid and effective treatment for fibroids. So I think we've covered a lot of what Erica's story is. She tells us about her post-op experience, and she's very honest. I love the way that she says that she's not exactly where she wants to be. The symptoms haven't 100% disappeared. I think that's a realistic way of looking at things, because yes, you can go ahead and have the myomectomy. Perhaps they've not removed all the fibroids, perhaps it's taking some time for the womb to recover. For different reasons, it might be that the symptoms, there's still a few symptoms, but not as bad as what it was. Let's not forget where she was coming from. She was coming from very painful, heavy periods, heavy bleeding. She was coming from a place where she was having difficulty emptying her bladder. She couldn't pass urine properly. She was coming from a place where she was having very frequent infections. She was suffering from bloating. The bloating was particularly uncomfortable. You can just imagine how that would affect things at work and so on. She was coming from a place where she was experiencing lots of exhaustion. The bleeding, as you can imagine, will lead to anemia. So that would lead to feeling tired and all that. What about some of the unspoken symptoms as well? I mentioned this in one of my recent videos, the stress effects of fibroids. And we talk about bleeding and pain and so on. We don't talk about the anxiety, we don't talk about the low mood, we don't talk about the isolation, the worry, the fear, the difficulty in explaining that this is what's going on, because many times the symptoms are underplayed or they're not taken as serious. How do you explain this to the boss or to a colleague, co-worker, and so on? And it's still many people think, oh, women's this periods, heavy periods and painful periods are women's lot and we should just put up with it. Absolutely not. We still have to keep educating people that this is where we are. We have so much more information about these conditions and how they can significantly affect a person's well-being. She is feeling much better since having the surgery. This is what she says to us, that things have improved. It's not 100%, but she thinks she's getting there. But I think the message that we want to get out from this, and thank you so much, Erica, for putting this out there for us to be able to discuss, to be open about your symptoms, not to be afraid to speak up about them. I think the other message is about not allowing anybody to tell you from their opinion. Seek a second, if necessary, a third opinion as well. If what they're saying doesn't seem to tally with what you do understand, ask around. One of the reasons I set up AskAwayHealth, my platform, was because I wanted a situation where women could just ask these questions. If you're not sure, if you want clarification, ask these questions. Let's provide you with health information, health direction that would help you put you in a stronger position or in a firmer ground to say, well, I've spoken to a doctor and this is what they think. You can say that to your own physician. I've spoken to a doctor and this is what they think. Can we consider this? What do you think about this? Patient care has to be that discussion between the physician, the doctor, who does have information and experience. Yes, but we don't have experience of your symptoms the way that you do. And I do believe that women should be able to bring forward their own concerns about their symptoms and how much is causing them. And we need to be able to listen to them while they do that, helping to empower Black women and moving forward. I think something else that's particularly interesting in Erica's story is after this video was shared, lots and lots of amazing comments. And I'm going to see if I can just go through a few comments with you on the channel. Okay, let's look at the first one. From Vero, please ladies, be your own advocate. I've had fibroids since probably 2009 with heavy bleeding and clots. Every gynecologist I went to, they told me I was too young to have them removed. 2019, 10 years later, I had a doctor that listened to me and actually said the opposite of what the other doctors told me. And he told me since I was young, 29, and had infertility issues, it's best to remove them. If I was older and menopausal and already had children, they would have probably let them be, depending on the situation. Long story short, I'm on my second pregnancy after my myomectomy in 2019. I have 3 others that I know of. Within a year of getting them removed, fertility issues get resolved. All glory to the Most High. I have to have a C-section with every pregnancy, but after suffering for over 10 years of infertility, I don't mind. So this is a look at somebody who had fibroids, issues with her medical practitioners who didn't appear to be listening to what she was saying. Eventually spoke to somebody who advised that given the fertility issues, myomectomy was a way forward for her treatment. So again, it's important to think about second opinion. If one doctor is saying something, if a particular treatment has been suggested or recommended and you've tried it for 6 months or a year perhaps and nothing's changed, might be worthwhile having speaking to somebody else. And she says she had surgery. So this is one of the ones I was talking about where they say they had surgery and were still able to go ahead to have children. Okay, so really interesting picture here. This next one says, yes, please speak up for yourself. The first doctor I went to said to me, well, a lot of people have them, as if to basically just deal with it. I was like, everyone has headaches, but that doesn't mean I want one. Exactly, yeah. It's a good thing I decided that comment was enough for me and went to see another doctor. This second doctor was so compassionate. So so this is what what I was saying about our agency as a patient as well. The doctors, yes, we have experience, they've taught us, and we have studies and research and the skills and so on, but we don't have your symptom experience. We can empathize. Yes, you can find compassionate people and doctors that will empathize, but it's also your agency to be able to speak up. And that's one of the things I want to encourage, particularly for us Black ladies. First of all, the knowledge and awareness empowers us, gives us that confidence, and we can speak up and push back on what someone else is saying. Here's another comment from Jennifer. It's a long one, but let's just go through because I thought it was there was quite a lot of detail. So she says, this is such an overlooked issue among women, especially women of color. I can relate so much to what she went through. She's talking about Erica. I had a myomectomy back in 2020 during the pandemic shutdown, and the journey to getting here was long overdue. Sadly, that is a common refrain from women. She goes on to say, I always had painful periods growing up since I was in junior high, but doctors I would see for checkups would say it was normal to have painful cramps. It is not. A lot of the time, commonly, young girls, teenagers have primary dysmenorrhea, and that's because of imbalance in the hormone levels, fluctuating hormone levels, because they're producing a lot of prostaglandins, and that can contribute to painful periods. However, when it carries on for a prolonged period of time, many times the most common treatment we offer is the birth control pill, and if despite that it's not getting better, it's getting worse, I would recommend stopping it and then arranging for the tests to see could something else be responsible for the painful bleeding. Okay, she says, and my mother unfortunately wasn't educated in that area, so she just assumed the same as the doctors. And she says her mom had a hysterectomy in 2018 from fibroids affecting her menopause, and I always was given painkillers to help reduce the pain I would experience. So painkillers aren't helping, the birth control pill isn't helping, we need to rethink what else could be going on. So she says, fast forward into my 20s, my periods became heavier, I bloated a lot more, the cramps were so bad that painkillers not helping, started taking the combination birth control in early 2020, and I, for some odd reason, experienced excessive bleeding because of the pill. Here we go. So it's not working, it should be stopped. It's not doing what it's supposed to do, and didn't know why, to the point where I had to go to the emergency room because the bleeding became excessive and I was becoming weak, and I was given an emergency transvaginal ultrasound, and that's when I found out that I had 4 fibroids. Fast forward to several ultrasounds and then being referred to gynecology surgeon. He was adamant about me getting a myomectomy in July of 2020 because of the fibroid sizes and location. Remember what I've been saying about what determines which treatment option. It's so many things: your age, where the fibroid is, how big is it, how many, and so on. Many things can determine, because there's some people that have 4 fairly small fibroids and they're okay with painkillers, or some people say they want to go down the natural route and they look at their diet and exercise and cutting down things here and then that might improve their symptoms. I'm not taking anything away from those people at all, but I'm just saying that one size fits all does not work. So you have to really open your mind, please, if you have fibroids. And don't say that because somebody did a video somewhere and they said drink apple cider vinegar and some mixture to shrink your fibroid. Doesn't mean that it's going to work for you. Please open your mind, get the information, sit down with a doctor to sort of go through your type of fibroids, where they're located, the number, and what could be the best option for you. Okay. So results from her surgery showed 7 fibroids that were taken out, and I was diagnosed with endometriosis. 2 years later, although I'm not exactly where I want to be, but I am 10 times better than where I used to be, and I am eternally grateful. Women, please be your own advocate and don't ignore your body. It's not normal to have painful periods and bloat like a full-term pregnant woman. It may not be fibroids, but whatever it is, seek help and don't let any physician dismiss your feelings. Okay, so there's loads and loads of different comments here. I don't know how many they are. There's quite a lot of different comments here. Here's a lady, Mrs. Ari Elo, says, I have fibroids and painful ovarian cyst that sent me to the emergency room. I still feel pain now after 3 months. I saw an OBGYN who basically blew it off, saying nothing to worry about. Oh dear. It's scary because I lost my mom a year ago to ovarian cancer. After watching this, I must get a second opinion. Thank you, Erica. I don't know how many times I've said thank you, Erica, but this is why I'm saying thank you, Erica. So if you're someone who's like Erica, you've got an experience and you're led to sort of do a video like this just to share and get us talking about this, thinking about our situation, then you're doing some good. Let's look at Nazinga. She says, literally, I almost cried when she was speaking. I felt like someone finally gets it. Oh, my sister. I've been suffering with this for probably 2 years now, and I can honestly say it's not a way to live. The pain and the discomfort can be so unbearable on some days. It makes me feel like giving up. Wow. My stomach is so swollen. You can easily feel how big my fibroid. Oh, my goodness. Bless her. Bless her. Here is Araini, cute roundness. I had a myomectomy with 22 uterine fibroids removed June 14th. I initiated the surgery after being offered several options. I feel like a new woman. My hats off to you, Araini. I always show all the best. Guys, we could spend hours and hours going through the different comments. Listen, I'm going to put I think they're even increasing as I go through them. More and more people are sort of going through this. At this point, as the time of filming, we're at 843 comments. I'm not sure when I'm going to finish editing this, but it's probably going to grow. And I'm going to put, like I said, I'm going to put the link to the description, the link to the video. I'm going to put it for you in the description box. I mean, you can pick it up from here, but I'm going to put the link in the description box so you can go ahead and you can watch this yourself. Key thing I wanted to bring out is what you've seen. These ladies have done it better than I could, shared experience about the symptoms, and many of them are saying how they've had myomectomy and improved their symptoms. By no means am I trying to say myomectomy is the best solution for everyone. I'm saying it should be considered and weighed given your symptoms, given your preference, given the different aspects that we've talked about, so that you can experience, we all deserve to have that experience of quality life free of pain and bloating and distress and abnormal periods. We need to come away from that, and I think this is something that providing us this, sharing her experience, has been able to do for us. Well, thank you for sticking around to the end of the video. I hope you found it helpful. I would love to hear back from you, what your thoughts and comments about. Let me know in the comments section. Don't forget that I have a great fibroids knowledge series playlist on my channel, and recently we talked about managing fibroids in pregnancy. Another video I have on the channel also looks at why you are at risk of fibroids. Make sure you check these out, and I will see you again soon.